If you're over 70, people often assume that the more medications you take, the safer you are. Pain relief for the joints, pills for digestion, tablets for sleep, and mandatory prescriptions that seem to be part of getting older. But cardiac surgeons, geriatric pharmacists, and internal medicine experts emphasize something that rarely gets said. Past 70, the greatest risk to your health is often not the condition itself. It's the wrong medication at the wrong time. Not because these drugs are bad. Every one of them has saved lives or brought relief in the right situation. The problem begins when they are continued automatically, without symptoms, without review, or simply because they were started years ago and never reevaluated. The aging body processes drugs differently. Kidney function changes. Liver metabolism slows. Blood pressure regulation becomes more fragile. And what once worked well in your 50s can quietly create heart strain, dizziness, stomach bleeding, falls, or dangerous hospital stays in your 70s and 80s. That is why medication reviews become more important with age. What protects you at 55 might harm you at 75. The goal after 70 is no longer the most medications, but the right medications for your current health, your lifestyle, and your goals. Here are the 5 drug types seniors should never accept automatically. Drug 5. NSAID pain pills without medical supervision, ibuprofen, diclofenac, naproxen, and similar drugs. Over-the-counter pain pills feel harmless because you can buy them anywhere. But these medications change how your kidneys and blood vessels work. They cause the body to hold salt and water, raise blood pressure, and increase pressure on the heart. In seniors, this can trigger heart failure, sudden kidney injury, and life-threatening blood pressure swings. They are also recognized as a leading hidden cause of internal bleeding in adults over 70, especially when combined with blood thinners. Even diclofenac alone has been linked with a higher risk of heart attack in older adults. These drugs were designed for short-term use, but many seniors take them daily for months or years, believing they are safe. If joint pain is a recurring issue, safer options such as topical gels, heat therapy, or paracetamol in adjusted dosage should be discussed with your doctor. Pain should be treated, but medication choices should evolve with age. Never continue NSAIDs long-term without a doctor reviewing the risks for your heart and kidneys. Drug 4. Daily acid blockers without a clear reason. Omeprazole, pantoprazole, and other PPI drugs. Acid-reducing drugs were invented for short treatment. A few weeks to heal ulcers. Today, millions of seniors stay on them for years. When stomach acid is suppressed too long, important minerals such as magnesium are no longer absorbed well. Low magnesium affects the heart's electrical rhythm, making palpitations and arrhythmias more likely, especially in people who already take heart medications. These drugs can also interact with blood thinners such as clopidogrel, reducing their protective effect. And long-term acid suppression has been linked with higher infection risk, weaker bone strength, and nutrient deficiencies that increase fatigue. If heartburn is gone, or if the medication was started years ago and never stopped, it may be time to reassess. PPIs are valuable when needed, but should never continue automatically. Seniors should regularly ask, why am I still on this? And is the lowest dose enough? Drug 3. Oral decongestants for sinus pressure or colds. Pseudoephedrine, phenylephrine. Many cold tablets that clear the nose. Also tighten blood vessels throughout the entire body. That means they raise blood pressure, speed up the heart, and increase the risk of irregular heart rhythm. For anyone with hypertension, atrial fibrillation, or heart failure, this combination can be dangerous. The challenge is that these drugs are available without prescription. People assume they are safe because they sit on a supermarket shelf. But in adults over 70, they have caused hypertensive crises, severe palpitations, and even stroke, if nasal congestion is a problem. There are safer solutions like saline sprays, steam, or doctor-guided nasal steroids. Do not strain the heart. Just because a drug is easy to buy does not mean it is safe after 70. Drug 2. Tricyclic antidepressants for sleep, mood, or nerve pain, amitriptyline, imipramine, and similar drugs. These older antidepressants affect the nervous system in multiple ways. They slow down brain signaling, weaken reflexes, and dramatically increase the risk of dizziness when standing up. That dizziness is one of the most common causes of falls, and falls are one of the greatest threats to independence in later life. They can also disturb heart rhythm, especially in people with existing heart disease. For decades, they were widely prescribed for chronic pain or bedtime relaxation, but now we know they increase confusion, constipation, urinary retention, and dangerous drops in blood pressure. There are newer options that do not carry the same level of cardiovascular and neurological strain. Tricyclics are rarely the first choice for seniors anymore. If one is still on your list from years ago, it deserves a careful review. Sometimes the most harmful drug in the cabinet is the one that has been there the longest. Drug 1. Routine calcium tablets without proven deficiency, high-dose calcium supplements for bone protection. This one surprises many people. Calcium from food absorbs slowly and supports bone naturally. But calcium tablets flood the bloodstream with high peaks that the body cannot regulate well. That excess calcium can deposit into artery walls and heart valves, accelerating hardening of the arteries. Studies have shown a higher rate of heart events in seniors taking high-dose calcium supplements without medical indication. And most people already get enough calcium from diet, dairy, and fortified foods. Without realizing it, bone strength is essential. But the safer way to build it after 70 is through vitamin D if levels are low, weight-bearing movement, balanced protein intake, and calcium-rich foods, not routine tablets. Supplement only when a doctor confirms true deficiency or high fracture risk. Protect the bones, but do not harm the heart. This principle is not about refusing medication. It is about refusing automatic medication. Pills that remain on the list simply because they were once added. A drug only deserves a place in your daily routine if it helps you feel better, function better, or reduce a meaningful risk in your current life, not a risk you had 10 years ago. If a medication no longer improves how you live, then its side effects, interactions, and silent strain on the body may be greater than its benefit. That is why doctors who specialize in senior health recommend regular medication reviews. Bring your full list to appointments. Include over-the-counter pills, supplements, and anything you take only as needed. The question should always be, is this still right for me? The right number of medicines after 70 is not as many as possible. It is the minimum number required to feel safe, stable, and strong. Your body has carried you through a lifetime. It deserves thoughtful decisions that protect what matters most, your independence, your clarity, and your ability to enjoy every day. Fewer pills do not mean less care. Often, fewer pills mean better care. Sometimes, the most powerful choice you can make is simply to say, I want to review this first.